Okay. Good morning, everyone. My name is Krista Moore, and we are here for the October Community Cafe. I just want to give everyone a warm welcome. Our topic this month is on depression and suicide awareness. And we have three speakers lined up today. And after each presenter or speaker has given their presentation, there will be time for questions and answers. However, if you do have a question that comes up in the meantime while a speaker is presenting, please feel free to do so and ask that in the chat. Also, if everyone could please keep their Zoom on mute while presenters are speaking, just so there's not any background noise. And the last thing is that Amani Pegues will be doing our monitoring the chat. So she'll kind of get with me if I don't see a question that was asked in the chat. And she'll also be doing the closing. So I'm going to go ahead and introduce the first speaker. We have Bowen Nutting. She is with Be Well Iredell. So I'm going to go ahead and let her take it away.
Good morning, everyone. My name is Bowen, and I am a community volunteer, former educator in Iredell County, and am going to share some information with you today about Be Well Iredell. I'm going to go ahead and share my screen. See if we can move this up here. And play from current slide. Okay. So Be Well Iredell is we're very fortunate in Iredell County to have Be Well Iredell established simply for us to work with Iredell County residents. For those of you who are familiar with Iredell County, is a very long and narrow county, and so to get from one end to the other can take about an hour. So we've got a big group of folks to assist. I'm just going to go ahead and read to you. I hate to read slides, but I think it's important for us to say this out loud. The problem that our organization addresses is the fact that our community is not in a space where every resident thrives with hope and resilience. Our emotional well-being and mental and physical well-being is not being prioritized enough. Protective tools to help individuals avoid and cope with a moment of challenge are not readily accessible. To ensure that Be Well Iredell is effective, we will need to gather data into a common location to ensure that we are targeting the correct audience members with outreach efforts. So our goal is to create a community that does thrive with hope and resilience, where we stand together as a community that's committed to emotional well-being. And we are going to do that through collaboration, education, and support to our community members. So Be Well Iredell is essentially divided into three different I don't know the word to use, pots. We have three different groups of folks that we want to help. So, or actually, no, that's not right. Not three different groups. It's all the same people, but it's three different ways that we want to help. So we want to, I'm gonna go ahead and just go to the next slide. The first way that we're helping is with education and training. And so we have been going into schools already and teaching response skills to those who are in need and those in crisis. We're helping folks to build resilience skills and also building a training network. So opportunities for our county to look at in one spot for all the training options that are out there. So we've been in schools, we've been in businesses. We hope to be everywhere in Iredell County to offer things like QPR training, Mental Health 101, Community Resilience Model. One of our goals is to have folks within our group trained so that we can go out and offer education and training. But we also know that we're going to be limited in that ability. So we will lean on groups like partners to help us find the right training and opportunities for folks when they call us and ask us for help. The second area where we're working is in community outreach. And that's really just about reducing the stigma of suicide and mental health awareness, or increasing the awareness and reducing the stigma. Um, Really opportunities just to let folks in our community know that we're here and that we're having these conversations. So again, we've been to events, we've been to festivals. While we want to go to schools, we want to go to businesses, anything that we can do to get the word out there that we have these options available. And then the third thing that I think you guys, many of you understand is a huge issue, and that's access to support and care. And so, really helping folks that reach out to Be Well Iredell to find the services that they need, and to help them to create a roadmap to good mental health. And so we have meetings, and we pull together groups of local mental health professionals and people from all different groups, like education and law enforcement and health department, and partners, and um, people in the community that just want to be involved. And so we really are working to create that access to support and care. So that's really all that I have to share. The thought process with us presenting to you today is just to let you know that we're out there, and that we're looking to visit, attend, help, assist in any way. So does anybody have any questions about Be Well Iredell?
Thank you so much for presenting today. And your
Absolutely.
information was captured in the chat. If you have anything else that needs to be added, you can add that in for contact information. Another
Okay.
bit of housekeeping that I failed to mention at the beginning is that this meeting is being recorded. So in the event that you want to share this information with other staff within your agency, it will be available on the partners website in a few weeks. And our next speaker, if no one has any questions for Miss Nutting, is Stephanie Engel. She is the program director with the geriatric adult specialty team here at Partners. So I'm going to go ahead and let her proceed.
All right, good morning. Thank you for having me here this morning, and appreciating that if you're talking about depression and suicide, that it's important to talk about how that impacts our older adults. Certainly, we know that it does, and it impacts them a little bit differently than it does others. So it's good to spend time talking a little bit about that. So, one of the things that we know when it comes to older adults and changes as we grow older is depression is very common. However, clinical depression is not a normal part of aging. We hear a lot of people saying, well, memory loss is normal, dementia is normal, clinical depression is normal. None of those are normal. We actually know quite the opposite, that there are studies that show that despite increase in medical concerns and other things, most adults actually feel satisfied with their lives as they grow older. We also know that if you experience depression at a younger age, you may be more likely to experience it as you continue to grow older. But why is it different as we grow older? Well, same reasons as when we're younger: financial, psychosocial issues, but there are some other things. As you know, aging adults have an increased risk of severe chronic medical conditions. And those medical conditions, the more chronic they are, depending on what actual conditions, they can cause limits in functional abilities. So, what happens when you're unable to take care of yourself, walk around as much as you used to, exercise as much as you used to? That increases that risk of depression. Most importantly, and probably the biggest reason for all age groups, but most definitely for our seniors, is the increase in social isolation and loneliness. And right now, especially, there was something that happened a couple of years ago that increased social isolation and loneliness. Sure, many of you know what that is, but it's called COVID. So we see a lot of requests for depression, anxiety, loneliness types of trainings still due to COVID. We know that suicide is a preventable tragedy, but it keeps happening, right? And it happens a lot as people grow older. So much so that it's a growing public health crisis. And nearly every group experiences an increase in suicide rates, but especially our older Americans. Compared to 2021, suicide death rose 8.1% among those 65 and older. And if we look at the actual numbers, that's a staggering amount of people. And while older adults are only almost 17% of the population, they make up 22% of suicides. This is usually the point where when we do trainings in person, I ask people, so what age group has the most suicides? Completed suicides. And despite that I'm there to talk about aging, I always get those common answers of 20 to 30-year-olds, of course. 20 to 30-year-olds may actually attempt the most, but they do not have the highest rates of completed suicides. It's actually older adults. In 2022, among those of almost 50,000 suicides, 21% are 65 and older, despite the fact that they have a lower population. Why? Why is that? A couple of reasons. They have more thought out plans, more time to think of those plans. They are more likely to use lethal methods. Males tend to use guns, whereas women will use pills, other methods. But again, when we think about aging and all of those increase in medical issues that we talked about, what does that come with? A plethora of medications, right? So they have at their disposal lethal methods. We know that 1 in 4 older adults succeed compared to 1 in 200 use. That's huge. Even those that don't commit suicide, the things that happen as a result of their attempts make them less likely to recover. So they may have other medical issues that cause their death. We know that men 75 and older have the highest overall rate of suicide. That's to any age group at all. And when we look at, well, what's that? What are those symptoms? What are those causes for that? Easiest way to remember that when we're looking at the aging population is the 4 Ds. We have depression, and we're not talking about just sadness or just trouble sleeping, but we're talking about clinical depression. Several of these different symptoms rolled into together for the actual diagnostic criteria of that, which is every day, all day, 2 weeks or more. So it's not necessarily just one of these things, but it's a combination. You also have the disease and disability, which is those chronic illnesses that come with an impact on functioning. If we can't do for ourselves, then that increases that risk of depression. The biggest one that we talked about, and I'll talk about again, is that disconnectedness, the lack of social connection or withdrawing. And then also deadly means. We talked about that, but they have the access to those lethal means. Over 75% of men utilize firearms for suicide. And what is it about that social isolation or disconnectedness? It can cause that depression. It can increase actual clinical depression. If that loneliness is ongoing, interferes with daily life, then I certainly urge, whether that's you or someone you care about, someone you take care of, that you urge them to talk to their primary care providers. Have them talk about the help that is available, whether that's social resources, that's medication due to the clinical depression that results from the isolation. Have them talk to somebody about that. And I would also urge you to, with those primary care providers, it's not just, oh, that's just part of getting older. It's okay if mom's 80 and she sits at home alone. It's okay. Sometimes you'll hear that too, even from primary care providers. So be the advocate for them and make sure that people know that that is not just a normal part of aging. Also, the cycle that we see is sometimes people self-medicate with alcohol due to that depression. When they do that, then they're less likely to be a part of those family events or social events that they need to decrease the depression. So it's that cycle that goes on and on. Other contributing factors that are just important and things to look at: grief, loss of a loved one. Obviously, we see that more as we age. Loss of self-sufficiency, the chronic illness and pain that we talked about, and cognitive impairment is the big one. Older adults with mild cognitive impairment and dementia have a higher risk for suicide. Some of that is because they're slightly aware of what they're not aware of initially. The other part is that declines in cognitive function affect their decision-making abilities and they increase impulsivity. So it may be not a well thought out plan, but it may be impulsive action. And then, of course, there's also the financial troubles. So that's across every age group, but they can't get that second and third job like somebody in their 30s or 40s. They're on that fixed income, and that's just what they have. Warning signs. Again, one of these things may not be clinical depression, but a combination of them is something definitely we need to look at and be aware of. Loss of interest, especially in things they used to enjoy. Giving away items is a big one. Changing their will, giving away things because they want to make sure the right person gets them. Avoiding social activities. They no longer take care of their self-care, don't go to doctor's appointments like they used to. Or there's just a big preoccupation with death. I used to have a client in therapy practice who every week when she came to see me, she started with who died in the week since I had last saw her. She listed off all the friends and family that had died. So we started to kind of delve into, what is that preoccupation? Is it her own mortality fear? What is it? Isolation? Is it depression, grief? What are the things that cause that? Also, maybe they're not as concerned about their own safety anymore. So when you see these things, you definitely want to take action and support those people. How do we do that? We know that clinical depression is not a normal part of aging. We accept that and advocate for those people who do have that. We ask them about it. That's the biggest thing. And I say this all the time, and I've even worked with nurses who feared this, but I promise that asking someone if they're suicidal does not cause them to be suicidal. I've heard that, and I've heard, well, that's just going to make them think about it. No, it'll make them aware that you're concerned and that you care about them, and that alone may make a huge difference. So just ask them. And if you ask them and that answer is yes, I've thought about it, know the resources to give them. help them connect, whether that's medical resources, primary care, or that's social things like a senior center or adult day centers. And then most importantly, also just follow up with them. Don't ask them and then don't talk to them about it again. Give them a couple days, give them a week, depending on what that discussion is, and follow up and see how they're doing. That 988 suicide prevention hotline is very helpful 24/7 resource that you can always provide people of any age. The biggest takeaways, if there are any that you get, is suicide is one of the leading causes of death, especially for our older population. So it's not something to just take lightly. It is higher in older adults due to the depression, grief, chronic illness, and social isolation. And if you know someone that has those thoughts or behavior, there are ways that you can get help. Any questions?
Thank you so much, Stephanie, for presenting this morning. We really appreciate it. And if there are no questions, we are going to go ahead and go with our last presenter, which is Shelby Holland. She is the tribal liaison here at Partners, and she's going to give us some information regarding Native Americans and depression and suicide.
Hi, everyone. Good morning. Give me 1 second. All right. Hello, everyone. My name is Shelby Holland, and I am the tribal liaison with Partners Health Management. I have a master's degree in social work. I am a licensed clinical social worker, and I am a proud member of the Lumbee tribe. Today, I will be talking about depression and suicide in Native Americans. We decided this was important to present on this month because next month is Native American Heritage Month. So we hope that this information that I am presenting on today will set the tone for why November is so important. Today we will be covering the following data. I do a lot of trainings and presentations, and I am a firm believer that we cannot really understand the magnitude unless we are able to see concrete facts. And I'm very type A, so numbers for me make things super clear. I hope it will for you as well. Following data, we will be going through comparisons. So using some of that data and looking at how it differs from other races and ethnicities. We will then jump into trends that we are seeing in the Native American culture concerning depression. After that, we will jump into my position and ways Partners Health Management is trying to address the health disparities and social determinants of health that Native Americans face every day. Lastly, we will end on a positive note and hit on how you all can celebrate Native American Heritage Month. I did add a warning picture on this slide just to remind me to put into place a trigger warning. The information I'm going to share is upsetting and could definitely impact listeners. So please feel free to step away or mute me if you need it. If after the presentation you feel like you need additional support, my contact information will be on the last slide, and I can also put it in the chat afterwards. So let's go ahead and jump in. Super busy slide. I'm going to walk us through it. So starting off with data, we will begin with male American Indians and Alaskan Natives. I want you guys to kind of focus on these first 3 columns here. And we give you guys a second. This is going to be the ages. This is going to be the American Indian Alaskan Natives, and this is going to be non-Hispanic white males. So I'm going to give you guys a second to look over the data. And you can see that there is almost a yin and yang situation with the data here. American Indians and Alaskan Native males are more likely to complete suicide from ages 15 to 44. And then white males are more likely to complete suicide from ages 45 and over. Things look a little different for women if we want to jump on down, looking at these same 3 columns. You will see that women who identify as American Indian and or Alaskan Native are more likely to complete suicide from ages 15 to 44, which aligns with the males. But you see this big decrease in women who identify as white, with these numbers being significantly lower. I thought this was important to include, so that if you are a stakeholder or a provider or just a friend to any American Indians or Alaskan Native tribal members, just make sure you're checking in on depression symptoms. Just like my counterpart Stephanie said, statistics show us that talking about depression and suicide does not increase the likelihood of that person completing suicide, but it does increase the amount of support that they feel and the reassurance that they have a safe place to talk about it. I'm going to jump to the next slide. For those of you that comprehend things a little differently and graphs are not easy to follow, that's definitely me. I wanted to put in some facts and sentence format to really drive the point home. So in 2020, the overall death rate from suicide for American Indian adults was about 40% higher than white adults. In 2021, the death rate for suicide among Native American, American Indian females ages 15 to 19 was more than 5 times higher than for white females in the same age group. In 2022, suicide was the second leading cause of death for American Indians, ages 10 to 34. I'm sure that number 10 is super shocking, but it does start at a very young age in the Native American culture. Jump to the next slide. Here is a line graph to show the impacts of suicide deaths. The solid line here is for male American Indians and Alaska Natives, and the dotted line is for female American Indians and Alaska Natives, and then this bottom line is just for ages. From this graph, we can tell 2 things. Number 1, male American Indians and Alaska Natives are more likely to complete suicide. And 2, American Indian and Alaska Native suicides are more likely to be completed between the ages of 5 and 24. Really heavy stuff here. So after presenting on all the data in my trainings, I always get asked the question, why? Why do American Indians and or Alaska Natives complete suicide at young ages? I'm going to give you guys a minute to read the most common contributors based on research, and then I'm going to jump into a few of them, but I'll give you guys a second now to read over. Unfortunately, I don't have enough time to go in depth for each one, but I did want to hit on a few that I feel that are not self-explanatory and are more on the cultural side. So if you see that last bullet on the left side, lack of identity, since the, and I'm putting quotations up if you can't see my video, since the discovery of America, Native Americans have been misidentified, right? We were thought to be Indians from India, and that has continued out through today's society. Even today, we're mistaken for Pacific Islanders, Hispanics, Black, etc. And unless you live on tribal lands, surrounded by others that look like you and have similarities, it is common to find yourself feeling like an outcast. For me specifically, I was born and raised in Charlotte, so I did not grow up around tribal members outside of my family. And I never knew why my family did things certain ways or why they dealt with things like so much substance use and untreated mental health disorders. It's hard not knowing who you are or not being accepted. I mean, if you just take a look at the LGBTQ plus community suicide rates, right? That feeling of not being accepted really drives a lot of their reasoning. The next bullet I want to hit on is the first one on the right side. Native Americans are 2 times more likely to be killed by an intimate partner, whether that be current or previous. So sometimes people who are trapped in an abusive relationship and are trying to escape find themselves fighting thoughts of suicide. Would it be easier to not be alive than to continue to deal with this? I hear that thought a lot. It's very common when you feel like there's no other way out. The last two that I want to talk about kind of go hand in hand on the right side: discouraged advancement and cultural reasons. If you grew up on tribal lands, leaving can be a challenge. Leaving a tribal land can mean more opportunities for your education, career, etc. But there is an undertone of resentment from others who are not presented with the same opportunity. So you can definitely be put between a rock and a hard place, and the rock being potential success and the hard place being feeling like you are abandoning those that you love. So the cultural reasons bullet is there because in my culture, if someone hears that you're Native American, 9 times out of 10, the first question they're going to ask is, who are your people? So you as an individual will always, at all times, represent your family. So if you are impacted by depression or other mental health issues, for example, if I go to a behavioral health facility for assistance, am I dishonoring my family? Am I bringing shame to my family's name, reputation, by admitting that I'm not well? Do I want to be the one who makes my family look less than? This is a very, very big issue in my culture. We are taught to pray through it. We are taught to utilize spiritual traditions such as talking circles, meditation, smudging, and ignore it because, quote unquote, everyone is sad sometimes. Although this is the current reality, my hope is that with the younger generations being so vocal, we will eventually get to a place as a culture where mental health is not so negatively stigmatized and you actually get praised for seeking help and breaking some of those intergenerational trauma behaviors. Go to the next slide. Like I said at the beginning of the presentation, I am the tribal liaison for Partners Health Management. So what do? I assist our staff members and community stakeholders to understand the needs of our state and federal recognized tribes. I provide trainings on marginalized populations for our community stakeholders, providers, as well as partner staff. Partner staff is required to attend an annual training put on by me to ensure that they are able to successfully work alongside tribal members, no matter the capacity. I mean, even from billing, I'm working with our billing department to make sure if a tribal member calls in, how we go about having a discussion. Lastly, I work collaboratively with tribal leaders and community stakeholders to build a network of services and supports for our Native American members. The state of North Carolina has 3 other tribal liaisons on the mental health side of things and even more on the physical side of things. So the state of North Carolina made this a requirement around, I think it was around like 2021. And our hopes are that integrating Native Americans' needs and having a tribal employee, we will be able to build rapport with the tribes and figure out the needs, service gaps, and how tribal members continuously slip through the cracks that is treatment. So that's a little bit about what I do. I'm going to jump to the next slide. Lastly, and we are going to send these out, and I can also put them in the chat. Here are some links that include virtual and in-person opportunities to celebrate Native American Heritage Month. I do want to show you guys this last one. This is Partners tribal web page. And I'm going to scroll all the way down. There's a lot of good information on here if you guys have time to just check it out. I'm going to scroll all the way down though to under community resources. You can see that there's a video there of me. Last year, we hosted Native American Heritage Month amongst the state of North Carolina. We had tribal leaders from, you can see all 8 state recognized tribes here, and they got to present on a topic of their choosing. There's also a training on this side right here, Partners Travel Orientation on Demand webinar. If you want more information on the historical barriers and just other important information, it is on demand, so you can take it whenever. And I hope that you guys will. I think the more education that's out there, the more we can really help our tribal population. I'm gonna jump back to my PowerPoint. Okay. The last slide is just my contact information. I'll put it in the chat as well, since my slides won't be up here for the rest of the presentation. And I'll also take questions or comments now if you guys have any. All right. Well, I appreciate you guys. I'll put that information in the chat.
Thank you so much, Shelby, for presenting today. We really appreciate it. And if there are no questions, and I did not see any questions in the chat, I hope I did not miss anything. I'm just going to open up the floor one last time if there's any questions from anyone.
Krista, I just wanted to speak real briefly about QPR. We and this goes back to just support and training to the community. About a year and a half ago, a young lady received QPR through Partners, which is question, persuade, and refer. Earlier this September, some of us were at an event, and at the event, the person who had received that training a year and a half ago came up to us and noted that in their employment, they had an opportunity to engage someone. And because they had taken QPR training, that they recognized things were not appropriate and where they should be. So they spoke with the person and questioned them. Then they persuaded them appropriately, and then they referred them for support and treatment moving forward. So it's not a matter of if, it's a matter of when you'll be faced with this. And QPR is something to have in your toolbox that can help you moving forward. And I didn't know if Amber or someone from the training team wanted to speak briefly about that at all, but I just wanted to share that story. I do work with Be Well Iredell, and it's a great effort. Those things are happening in multiple communities. Please get connected if you're not already touching those efforts for mental health and suicide prevention. But Amber, I don't know if you wanted to speak to it.
Sure. Thanks, Jerry. Yes, we do offer QPR, again, question, persuade, refer. It is a 1 hour / 1.5 hour training. We like to build in that extra 30 minutes just for questions or comments or conversations surrounding suicide prevention. You don't have to have a huge group of people willing and able to do this training. As long as we have 4 or 5 people. I've done it for 1 or 2 people before, but it's just a matter of getting the knowledge base, finding out what the warning signs are, taking those things into consideration that Stephanie mentioned and that Shelby mentioned and that Bowen mentioned, looking for those warning signs, and then also figuring out how to ask that question, how to persuade to get them some help, and then who to refer them to. 3 quick, easy steps. And like Jerry mentioned, not a matter of if you ever have to have this conversation, it's a matter of when. And we want everyone to be prepared for that conversation when it happens with you. So if you were interested in attending a training, please, I will put my email address in the chat. You can reach out to me there. I can add you to our listserv. We offer QPR monthly, virtually each month. Sorry, I should have said it the other way. Virtually each month, and we also can come and do them in person, or we can do them virtually for a group of people as well. If you're interested in that, please let me know, and we can get our team out in order to have that conversation and provide that training for people who may need it.
Yeah, and on the cultural awareness side, yeah, I taught at UNCG, and we every single student in the nursing program had to have the QPR training, and there's a lot of studies out there about how those questions being asked by me versus those questions being asked by somebody who is someone that the person can relate to better. is really sometimes gives you a big difference in the response and the ability for them to feel comfortable speaking out. So when we're talking about our tribal communities, making sure that that training is something that's accessible to within the communities so that they have that as well. You speak better or easier to someone that you relate better to sometimes. And I know we did the first pilot of having our nursing students go through it at UNCG was we had in that first semester, we had four saves. That's we 4 kids that spoke up to someone, got the help that they needed. And that is, I mean, that's priceless. So it's an hour, a little bit more than an hour of time, but it is a skill set that's really important.
Thank you so much, Kim. I also wanted to note your comment in the chat, and I'll go back to the one previous to that. But you said that child and adolescent rates are concerning with suicide and depression, and you're a pediatric provider, and to keep you in mind for assistance. If you would like to, you can enter your information in the chat, email address or phone number. If someone is wanting to get in touch with you, that would be great. And also, Heather Jones said to everyone that she works for the International Center for Wellness located in Concord, North Carolina. And they are offering or excited to offer services to all ethnic groups and citizens as they grow their practice. A few other things to note in the chat. Amber has given her email information for the QPR trainings that she was discussing and talking about. The cost is free. The training catalog for partners health management is posted in the chat. It's also on our website. So I believe I've covered everything in there. And Amber also states we have 2 staff getting trained for Spanish QPR. So that's great. That's great to hear. So Heather has put in her chat information, and so has Kim. And if there aren't any other further comments or questions, I will turn this over to Monty to give our closing. Thank you so much, everyone, again, all the presenters and everyone who had feedback and information and everyone listening. Thank you guys so much for attending today.
Again, thank you all for attending, and thank you to the speakers. We hope that you will join us again next month for Community Cafe as we celebrate veterans and first responders. That Community Cafe will be held on November 27th, 2024, so the day before Thanksgiving. So hopefully you all will join us before you go on vacation, and thank you all. This concludes our Community Cafe.